The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Sierra Morgan and Samantha Kelly. Sierra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. Welcome back. Today, we are going to talk about something that is near and dear to our heart that nobody is told enough, and I feel like we cannot repeat enough times. Postpartum rest, no matter how you gave birth. I don't care if you had a C-section, yes. You still need to rest your bottom. Mm-hmm. Tell us about it, Sam. What is our number sequence we like to use? Not we, everyone.
So the 5-5-5 rule is something that I think is really important for people. We feel is very important for people. And so what that is that for the first 15 days after you give birth, we want you to be really, really restful. And we have kind of a sequence for what that rest can look like. So the first
we would love for it to look like, if not more.
We would love for it to look like. Yes. So the first 5 of that is we want 5 days where you are in the bed. And that means that you are more in a kind of laid back position, off of your perineum. You are resting and doing skin to skin as much as possible. You're spending probably like 95% of your day off of your feet, off of your hiney, and just resting. And the reason for that, there's a few reasons for that. One is that you have this teeny tiny fresh little baby that can have lots of skin to skin, especially if you are planning on breastfeeding. But even if you're not, skin to skin is still hugely beneficial for both of you in those first few days. And then there's also the aspect of you just pushed out a baby. You've gone through a lot. You've had 10 months of being pregnant, and then you went through a birth experience where you likely didn't get a whole lot of sleep leading up to it and during it. If you gave birth in a hospital, you probably didn't get a lot of sleep there because you have visitors in your room every 2 hours to check on you and baby.
Or more.
Or more. And you have just all of these different things going on. So you need to catch up on your rest as much as possible, sleep whenever it's possible, sleep when the baby sleeps, they all say. It's a lot more possible if you're laying down and you're in the bed for the majority of your day. But then also your uterus is doing so much stuff in those first few days. It is shrinking back down to its pre-pregnancy size. It's gone from this big size where it had a big old 8-pound baby in there. And it is rapidly shrinking down, both closing the wound where your placenta was attached and then going back to that pre-pregnancy size. And as it's going back to that pre-pregnancy size, all of your organs are trying to remember where they belong because they've been all like squished up. We have graphics of like what your organs look like while you're pregnant. It's kind of crazy because they're just like all squished up and around and everywhere. And then all of a sudden, this baby comes out and your uterus starts shrinking really rapidly. And all of those organs have to figure out where they're supposed to be now. And if you are up and moving about, they're kind of getting a lot more movement than what they are designed to be getting at that point in time. And so if you are allowing that rest, then your organs can kind of go back to their natural pre-pregnancy places without kind of falling down and putting more pressure on your pelvic floor, which is the last piece of this. No matter how you have delivered, whether it was vaginally or via C-section, you've had a lot of pressure on your pelvic floor in the days and weeks leading up to delivery. And if you had a vaginal delivery during delivery.
Yeah, the pushing.
Yeah, exactly. And so giving your pelvic floor rest so that those muscles can kind of tighten back up or loosen back up or whatever it is they're needing to do. Everybody's a little bit different. They can get that rest and start doing those things without the added impact of you up and walking and putting a lot of pressure on it. I hear from moms
From
all the time
gravity.
about how I was just talking to someone the other day who went on she was like, I just took a short walk about 6 blocks and she was maybe a week postpartum. And she said, and when I got home, I just felt so heavy. Everything felt so heavy in my pelvic floor. And that's a very common feeling in that first stretch of postpartum because everything is heavy in your pelvic floor.
Yeah, no matter if you had a vaginal birth or a cesarean, that uterus still shrinks back down. The organs still have to find their place. Something you can do to help this is like a belly binder or a belly wrap or even
Mm-hmm.
a belly binding ceremony. Those are things we actually have an episode if you want to go back and listen to it about belly binding that talks about this as well. And like, I want to touch on one thing real quick that you hear people say a lot, which is there's a dinner plate size wound in your uterus. I want to give two sides of this. Okay, yeah, technically, like when it first came off, it was a dinner plate sized wound. People say this in order to scare you into sitting still. And yes, that wound was there when the placenta detached from the uterus. But your uterus very quickly gets back down to like a double fist size. And
Mm-hmm.
when it does, that wound also has gotten much smaller, obviously, because your uterus isn't even the size of a dinner plate. So it can't possibly have a wound the size of a dinner plate. But just because it's not an actual dinner plate sized wound anymore doesn't mean you don't need to rest. You need to rest because of what she just said about all of your organs finding their place, because of your pelvic floor needing to recover and all of the pressure that's being put on it. And now the uterus isn't able to
Mm-hmm.
kind of block all of those organs from putting pressure on it. And then another consideration is if you had a C-section, like if you had a vaginal birth, you pushed. If you had a vaginal birth followed by a cesarean, or you're trying and you're pushing, you pushed and then you had a cesarean. Even if you had a scheduled cesarean and you never labored, you still had an abdominal surgery where they cut through the muscles of your stomach. And the muscles of your stomach, everything is so connected that the muscles that are helping keep your pelvic floor up and tight have now been cut through and are now having to heal. And all of that stuff is so interconnected. So you still even more so need to be resting. And we hear this
Mm-hmm.
dichotomy or this like double-sided talk of, but after you have a C-section, you need to get up and walk around because you just had a C-section. Well, yes, your intestines need to realize they need to function again. And like everything needs to know, hey, we need to move, and our bowels, hey, we got to go. Like everybody wake up. We just had
Mm-hmm.
surgery. So yes, you have to move a little bit more than you would have with a vaginal birth, but it doesn't mean you should be up walking the block. It is like, hey, make sure you're getting up and walking into the restroom every once in a while. And you're not just lying there in bed constantly. Do get up a little bit and move. That doesn't mean you should be exercising or walking even a half of a mile a day.
And that's generally in the first like 48 to 72
Yes.
hours when you're trying, because everything had the anesthesia from
Yes.
the C-section. And so we need to wake it back up. But once it's woken back up again, then kind of go back to
Rest.
needing to rest. And it's like a risk versus benefit. Like, is there still benefit in resting? Absolutely. But there's also more risk at that point of, getting
Prolapse.
constipated or
Oh, yeah.
prolapse or
I was
something like that.
yeah.
Yeah, and so we want to have that movement too. So that's a little bit of the C-section conversation. We get that, and we get that question a lot, and it actually took a little bit for us to figure out like how do we
I'm going to explain it
answer that.
best.
But
Yeah.
I think it's risk versus benefit.
What's really frustrating is, well, first of all, when we're pregnant or postpartum, our memory is not great, right? Like I'm 7 years
Mm-hmm.
postpartum and I say that our kids are really smart because they steal all of our brain cells.
Mm-hmm.
But we're even less likely to remember things when they're told to us during pregnancy. So many times I've told somebody something and then the nurse comes in and says something and they act like it's the first time they've ever heard it. And it's not because they're not
Yeah.
listening to me. It's because it just didn't sink in when I said it. And I can't be mad that they didn't hear it when I said it. So yes, people talk about resting postpartum and the 5-5-5 rule. Some OBs do, some OBs don't. Most midwives do, some don't. But even the ones
Mm-hmm.
that do, even if you have a doula that does, it's not always being heard. So I don't think that we can overstate this and we're not trying to scare you. We're trying to also remind partners as well. This is not
Yeah.
out of laziness. This is out of necessity to help protect the pelvic floor, to help protect long-term problems like pelvic floor prolapse, incontinence, things like this that are long-term. So
Mm-hmm.
pelvic floor therapy is a really great thing. I think everyone should get a pelvic floor therapy exam very soon after birth, whether you think
Mm-hmm.
there's a problem or not, because it's
Mm-hmm.
really good to just get a one-time assessment and see if there is anything that's going on. But in general, this is not oh, I'm being so extra and lying around. This is a medical necessity, really. And it should be a non-negotiable that we're giving
Yeah.
space for people to rest. And sometimes it's the partner doesn't think they need to, but sometimes it's the person putting so much pressure on themselves to hold themselves up to
Yeah.
the standard of what they did before, or their mental health needs to get up and move and do things. So I do
Mm-hmm.
think there's some balance here. If you're someone who's like, if I'm in the bed, on the bed, and near the bed, I'm going to be lonely and I'm going to
Yeah.
not be in a good mental health space. It can be in the bed, in the couch, on the couch, around the couch. It could be in the
Yep.
recliner, on the recliner, around the recliner. It doesn't have to be in a room by yourself. So I do want to make
Yes.
that distinction that it doesn't always have to be isolation. It just
Yes.
needs to be the way we're treating our body. So it can
Right.
be in the living room if you need it to be.
Yeah, 100%. And I think so. Like going back to the 5-5-5 rule. So the first five of that is in the bed or in the recliner or in the couch, whatever. It's we want you to be mostly reclined, kind of off of your perineum, not like straight up and down like how we're sitting right now. So we talk about in pregnancy how we never want your belly button pointing at the ceiling. In the first 5 days, I want your belly button solely pointing at the ceiling. That's you
Right.
get to get all of that benefit of sleeping on your back now. That is really, really beneficial. The second five is 5 days on the bed. So this means you can be more seated, you can be more upright. Maybe you're sitting up on the couch, but I don't want you up and walking around. I don't want you going and cooking dinner or taking long walks around the neighborhood or being running up and down the stairs multiple times a day. This can be really hard for people who have other children and who live in multi-story houses. But going up and down the stairs puts a lot of pressure on your pelvic floor. So in those first 5, 10, even 15 days, I would recommend not going up and down the stairs more than once, maybe twice a day, as much as possible, especially in those first 10 days. So on the bed, on the couch, whatever, sitting up, playing with your kids. Maybe it means you're sitting down on the floor and you're playing Barbies with your 3-year-old or dinosaurs or cars or whatever, but you're not
Uno.
going in there and making dinner. You are not, getting up and doing all of these things. Take a shower, but still off of your feet. I would say at this point, if the first 5 is 95% of the time off of your feet, this point is probably 90% of the time off of your feet, I think is really helpful. And then the last 5 is near the bed. So I want you to be really mindful of how your body is feeling. If you're getting that really heavy feeling in your pelvic floor, means you're probably pushing it a little bit too much and it's time to sit down and take a rest. I want you probably 75% of the time off of your feet at this point. So maybe you go and you make yourself a cup of coffee. Maybe you scramble some eggs or something like that. But I don't want you going and making a 10-course dinner or going to the grocery store or doing all of those things in that first 15 days, because none of that is going to be really helpful for you and your body. And you need lots of rest. Of course, some of these rules are going to have some flexibility based on what's going on in your life. When I had my first baby, he was in the NICU. And so I was up and walking to the NICU because they told me I couldn't be in a wheelchair. So I was up and walking to the NICU multiple times a day because that was what I had to do. In order to see my baby and hold my baby and be with him. I didn't get to recline. I had to sit in a hard hospital chair while I was watching him. So that was really difficult. With my second baby, we made the brilliant decision to move 5 days after having my baby. And yes, I did stay off of my feet and I didn't help with the moving process. Still probably wasn't as restful as I could have been. And now as we're thinking about this third baby, I'm like, I'm going to do it this time. I'm going to be in my bed. Everyone's going to be
Now you
serving
have
me.
a
It's
bunch of
going to be
doulas in your life
glorious.
who are
Yeah.
going to be like, ma'am, I done saw that picture of you on Instagram. Sit
That's
down.
exactly right. It's going to be great. Kids are never
Another
going
thing
to see
about
me.
this is it could be the opposite way. It could
Yeah.
be what's going on in your life necessitates more rest than this. And by the way, this is really a minimum, a bare minimum.
Oh, yeah.
But the other side of this is we have some people who in pregnancy are experiencing symptoms of prolapse. That was me during my second pregnancy, and I didn't know that meant I should rest more after my pregnancy ended. And so I started showing signs of prolapse, prior to 12 weeks pregnant with my son. And they had things for me, told me things to do to help, or not help necessarily, just like not exacerbate it. And then after I had my son, I had such extreme prolapse at the birth center. Like I noticed then, right after birth, that I was having prolapse, and nobody gave me any guidance.
Yeah.
And you could say, maybe I don't remember. Sure, maybe I don't. But I really don't think that they told me anything. Like I was asking a lot of questions actively about what was going on with my body. And I was told, it's okay, like it'll go back. But nobody gave me any parameters for lying down. And this is before I was a doula and really knew about the 5-5-5 rule. So I was even under midwifery care and still didn't get as much guidance as I should have. And we have somebody right now with us that is experiencing it like at 25-ish weeks pregnant. And so afterward, it's going to be even more important for her. And she may need a longer rest period because she's already experiencing symptoms of prolapse during pregnancy. Yeah. So ask the professionals. Pelvic floor therapists are going to know a lot more than a midwife or OB with this because, just like you need a specialist for different things, right?
Yeah. And in your situation, you didn't get that rest and your prolapse didn't improve and you went on to have some medical things happen because of that.
I have no more side of that. I have no more uterus or cervix or anything anymore. We got rid of it.
Prolapse. It's gone.
It prolapsed so much, I got rid of it.
Got rid of it. On the flip side of that, I have a really close friend who experienced prolapse with her second because she had difficult pregnancy. After she had that baby, she was up and moving and wasn't listening to a word that I, as her doula, was telling her to do. She did I think she had a birthday party for her oldest like a week later. It was crazy town. And she had a lot of prolapse and she and her doctor kind of came up with the plan that if after their last baby, it was still there, then they were going to go in and have to do a surgery to fix the prolapse because nothing she was doing was really working a whole lot. And then with her third pregnancy, she took everything really seriously. She was doing pelvic floor therapy and she was doing all of these things. And after she had that baby, she was very intentional, much more intentional than she was with her last two about resting. And you guys, her prolapse is gone. Like she was so much more intentional about it. And she had the benefit of it kind of fixing on its own, which doesn't happen with everyone. But her situation, her being mindful about her postpartum rest was hugely beneficial for her. And she got to avoid surgery because of it.
I do want to say my situation is very extreme. So if you're listening to this and I just scared you, I also have a medical situation that makes my connective tissue kaput and then it doesn't go back. So most people can rebuild muscle and help with this sort of thing. So pelvic floor therapy usually is a very good option for people that can be very restorative, especially when started early. I just unfortunately had a medical situation that was like, oh no, we're not going back anywhere. Thanks for the offer, but no thanks. So don't let me scare you too much, but it is important to get help early if you are experiencing symptoms of this.
Yes. And rest your body.
Rest your body. Lay down. That's it. Sit down. All right, you guys. Thank you so much for listening, and we will talk to you soon.
Bye. Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.